Good afternoon. My name is Rob, and I just wanted to share my infographic with you. Obviously, it's centered around aquatic therapy for stroke rehabilitation. I've written for this topic before, but never produced it into a infographic. So my goal here is to review this with you, and hopefully you can learn some insightful knowledge here. What populations are affected? As it says here, strokes tend to be occurring in all ages, but the majority of the percentage are going to be in the older populations over 64 years old. Some risk factors include high blood pressure, high cholesterol, smoking, obesity, diabetes. In fact, these are all actually the leading causes of strokes. There's multiple types of strokes as well, but they all revolve around the idea of a disruption in blood flow, systemically leading to other parts of the body, resulting in dead portions of tissue, ultimately disrupting our function as humans. In fact, 1 in 3 adults has at least one of these conditions or habits, those risk factors mentioned earlier. And these strokes are going to be reoccurring in 25% of the population of those who've had one before. So it's even that much more essential that if you've had a stroke in the past, you try to minimize those risks in your lifestyle. Why aquatic therapy? It's well known that the physical properties of water are the main contributors behind the benefits, particularly in stroke patients. When compared with land exercise, aquatic exercise for improvement in just about every category shows to have higher success rates. And then these hydrostatic properties entail viscosity, hydrostatic pressure, and buoyancy. All can go into much more depth beyond the infographic on what these properties actually do and how they assist the stroke patient as well as the provider. And then just to kind of summarize it all up, the perceived benefits include a long list of benefits. Some of the lists here: improved mobility due to that reduction in body weight. In fact, submersion in water decreases the body weight of an individual by up to 90% when submerged up to their neck. And this makes it easier for stroke patients to move all throughout ranges of motion in their joints. Then you have viscosity, as mentioned before, where it's going to slow the movement and provide support neurologically. It gives one more time to kind of think through movement and neurologically connect to their appropriate receptive function and choose where they want to move. Along with that is going to come the reduced risk of a fall, increased sensory input, and just as mentioned before, it's an equal resistance environment. We're also going to get some muscle relaxation, reduce stiffness and spasms, as well as increased support from this hydrostatic pressure, kind of pushing in on the body outwards. Then we have pain relief. This is going to come with the systemic blood flow changing, and actually your heart's going to pump much more efficiently, reducing inflammation in many parts of the body. We're going to have an increase in flexibility because there's less gravity. All that cardiovascular, the facts mentioned above, tie into the cardiovascular health and its benefits. Increased respiratory rates as there's reduced stress on the lungs and submerged under water. There's reduced chances of future stroke if you were to participate regularly in this rehabilitation process and take the proper measures to adjust your lifestyle. And then, yeah, basically everything is covered there. And there's many benefits that you can read along, especially if you were to follow through with the AQUA and the AEA associations for aquatic therapy and stroke rehabilitation. But ultimately, the center of this all stems from our cardiovascular system and maintaining it and promoting a healthy lifestyle, whether it be from your diet to your sleep to your level of exercise and activity, and the list goes on. As mentioned in the core of my coursework I'm about to hand in for this project here. Thank you for joining.